This is LBC from Global, leading Britain's conversation with Nick Abbott.
Good evening. Among the eye-opening revelations that we've read this week about what was going on behind the scenes as we were all ushered indoors during the COVID pandemic is that Matt Hancock told aides he wanted to frighten the pants off everyone about the Kent variant of COVID to ensure that we complied with lockdown rules. Let's talk about this with Dr. Bharat Pankhania. Dr. Pankhania is a senior clinical lecturer in public health medicine at Exeter Medical School. Hello, Doctor.
Hello, good evening to you.
Yes, good evening. So you've, heard the messages and which have shone a light into the ways that the government reacted to this virus. Just generally to start with, what thoughts do you have about what you've seen so far?
It's appalling, Nick. It's absolutely appalling, and it's a disgrace. Let me sort of expand a little bit. Remember, people died alone. People were frightened. And in the middle of such chaos and fright and uncertainty, we have the Secretary of State for Health and Social Care talking in loose terms as if this wasn't really, really important and a sensitive issue. It really is disappointing that, okay, we're reading his private conversations, but the spotlight on his private conversations, it's appalling. It's absolutely appalling.
Well, is what you're referring to, this phrase, frighten the pants off everyone about the Kent variant, is that what you're referring to, or is it something else?
No. That phrase and several others where he is dismissive of, for example, Jeremy Farr, who is an eminent scientist, a knowledgeable person, and he's belittling him, for example, and being dismissive. And then again, and today we hear about, frighten the pants of people. You don't frighten people into coercive behavior. You inform, advise, educate, and you take the people with you. It's basic science.
Well, I find myself in an unusual position in that I feel I want to defend Matt Hancock. There was, I'm afraid I'm going to try.
You can.
Let me give it a bash. Yeah. At the time, all of the people involved were going through something that no one had ever seen before. This was unique in our lifetimes, and all of the people at the top of government, they were not of scientific mind. They had no knowledge, really. I mean, particularly, and this is, I suppose it's alarming, that the health secretary has no knowledge of health, but he was surrounded by people who were all telling him contradictory things, and yet he, Matt Hancock, had to be the one to, if not actually make the decisions himself, which he did in large part, but to own those decisions publicly. So what he said in private and the sort of language that he used, is that really relevant as opposed to the direction that he was taking the country in, which was, he's not a mass murderer. Let's assume that he was trying to do his best by us.
Okay, look, let's take this item by item, Nick, yeah? Whilst your opening line was, this was an unusual, unexpected, amazing situation, I disagree, because people like myself and many others in my business have trained for exactly this sort of thing. We're cool, calm, collected, nerve is required, we're trained, we know what to do, we know what to look for, and we've got plans. And here, the pandemic arrives, and we've got a Secretary of State for Health and Social Care not really listening to that advice that he doesn't want to listen to. Okay, so I haven't got all the minutes of old sage, but what we were finding, and the overwhelming theme kept on recurring, is how come the government is taking decisions that don't make sense and don't marry the plans that we were making. So let me expand a little bit on that. So we have primary care, We have secondary care, that's hospitals, primary care meaning general practitioners. Then we have local authority public health. Then we have Public Health England. And all of those sectors in the United Kingdom work in unison for the health and benefit of the population. And we found each and every one of those sectors was sidelined and new things were set up instead of working with existing structures. This isn't normal. This is abnormal. So general practitioners were sidelined. General practitioners could not even order tests for their patients, and general practitioners are the first line. Then we had the university and NHS laboratories who said, we would like to set up these labs and these testing, and we know how to do it. We're experts. We've done this for years. They were sidelined, and so on and so on. And then that new test and trace was created, whereas at Public Health England, where I have worked, we are experts in test and trace. So do you see, there is a series of organizations, everything, of which the head is the Secretary of State for Health and Social Care, and he took a series of decisions. And I would say, although I don't know, that the scientists would never have told him, I think you need to bypass NHS and university labs. I think you need to bypass GPs. I think you need to set up Nightingale hospitals. All of those were a waste of money and resources.
Yes, I mean, there's probably an investigation that could last from now until the end of time to try to figure out where all the money went for.
Yes. Why did you take those decisions to spend that money? Because look, I was involved with the pandemic, and I was saying, I cannot believe that SAGE has honestly said, do this. And then we learn that SAGE probably didn't say it. The minister was making the decisions, despite being told to the contrary by SAGE, for example.
Some of the more eye-catching things that have come out this week were the advice on testing people going into care homes,
yes,
and people are rightly angry about that. But is one of the basic problems of that there just weren't enough tests to go around, even if he wanted to, or even if he had ordered everybody going into a test home from both the hospital and the community, it couldn't have been done because we didn't have the tests.
Why lie about it then, Nick? Right, simple. Why lie about it? It's important to say, I haven't got enough tests, we're going to ration them, but in view of the fact that we know elderly people are extremely vulnerable, their case fatality rate, meaning if they get infected, their chances of dying are high, much higher than those for younger people. So a sensible Secretary of State for Health and Social Care would have said as follows: we're going to look after the vulnerable people. We're going to test them, and we're going to make sure we don't introduce infection into those care homes. Instead of having a generalized, well, we will sort of test if they're discharged from hospital, but we will not test if they're being admitted from the community. And Chris Withy, Chief Medical Officer, was telling the Secretary of State that really that would be an open door for infection to enter the care homes. And we know it did, and we know a lot of elderly people died.
On the policy of sending us all indoors for extended periods of time, I mean, there's a couple of countries that did different things, and they were outliers to the vast majority of countries on Earth that did more or less what we did. They're not necessarily at the same time or in the same order, but kind of the same. And one was Sweden, which had a much looser and more sort of liberal small L policy, and one was China, which went the complete opposite direction. So tell us then what the result was, if that's not an unreasonable question.
No.
Okay.
No.
What result then did Sweden have by being more liberal, and China have by being more authoritarian?
Yeah. So, with respect to Sweden, Sweden is a country that is not high density population. It has got cities where there is high density, but it's not London, and it's not Birmingham, it's not Manchester. So our population in the United Kingdom, we're a crowded country. Sweden was able to be much more liberal because apart from its cities, it's open space, and open space is a low risk. We know that. And even I myself was questioning in the UK, why are people not able to go for a walk in the woods on their own? They pose no risk to anyone. And yet we had these rules in the UK which said, you will stay put, you may not exercise for long periods outdoors. That was an error. Now, let me just come to China. China did really well with its test, trace, and contain in the first early phase when we had no vaccine. Unfortunately, then when the vaccines were invented, China had less performing. In other words, our mRNA vaccines were higher performing compared to the Sinopharm platform of vaccines that China is still using. They're less good, shall I say, okay? And they didn't immunize as many people as they should. So they continued with their strict lockdown measures instead until, they'd gone through some election cycle, etc., or whatever internal politics they have, and then suddenly did a U-turn. And then they are furiously at pace immunizing the elderly and other vulnerable people, etc. So that's what happened in China. In other words, they kept the population so isolated that it was as if when they meet the virus, they would be meeting it the first time, and if they were elderly and frail, they would get infected, they would die. Or not all of them, obviously, but the vulnerable ones, a percentage would die.
So if it was a choice between, in Boris Johnson's words, taking it on the chin and the route that China took, then it would perhaps be better to do the Boris Johnson thing.
No, I wouldn't take it on the chin, because what I would do is this. And in the UK, within reason, we achieved it, but you don't want to take it on the chin, because these are human beings. These are somebody's grandparents, etc. And then there are these people with, vulnerabilities. They may be in their 30s, 40s, 50s, etc. I'm not allowing anyone to take it on the chin and hope for the best. So a good government, a good governance would say this: find me all these vulnerable people and I want to protect them. Right? That would be the minimum you do. And I really want to protect them, and I want to make sure that whilst I'm protecting them, somebody doesn't come and infect them, i.e. their children or whatever. And that would be a moderate middle-order thing to do. But to take it on the chin, per se, is unacceptable, because that implies take it to chance, when we know that if you take it to chance with your elderly mother and she gets infected, then she has got a 5-6% chance of of dying. That's very high.
Psychologists have said that the very act of locking us all up is having long-term unfortunate consequences to people's mental health. So it's not all a positive to lock people down, is it?
No, Nick, and I so agree with you, because we could have done it better, and we didn't do it. We used a broad brush to lock people down. So, this is the pain. We mustn't forget, we went into lockdown late, we came out early, and then we went into lockdown again because we had to, and then our lockdowns were therefore prolonged, whereas what would have been much better would have to have a more sensible policy of course you can go for the walk in the woods. There's no reason. Nothing in the woods is going to infect you, that sort of thing. The second thing is act fast, act early. And if you act fast and you act early, you subdue that spread of virus. And having subdued it, you come out of it early. And therefore your mental health and all those things, the economy, are preserved. So the person who messed up the economy and everything else, which they like to sort of now forget, are the government. They acted late, they acted in a sloppish way, and then they said these lockdowns are hurting the economy. Well, the hurt is your fault. You went in late, and you came out early, and then you went in again. Do you remember, Nick, there was one occasion where after one day the schools were shut? What was all that about? Do you remember?
Yes, I do. But was one of the problems that the government had at the time that they were facing 65-odd million people, and they didn't really know what our reaction to this was going to be, because this was going to be the first time that any of us had been told that we, the government, are now taking away your freedoms. So is it not understandable that they were reluctant to lock us down because they didn't really know how long we were going to put up with it?
I know, and that was one of the issues about the late lockdown. In amongst all this, because I do recall, is there was the distraction of Boris Johnson and Brexit, and he never attended the first early Cobra meetings. We didn't know, but what we could have done was to keep that calm, collected air of, we've got to do something. Now let us do it sensibly. We don't want to be draconian. But we ended up being draconian because we dithered on taking the early decision. That is the tragedy. So those early, general, liberal, sensible decisions would have prevented the prolonged shutdown, etc., that we had to endure, unfortunately. It is a mistake. They have made a mistake. And I say it with a lot of confidence because, Nick, we practiced all these things. Right? So people like myself practice pandemics, and we practice scenarios like this. We knew what to do. And then all those plans that we had made were thrown out of the window. And they were making it up as we went along. And they then say in their defense, but it was SARS. It's not true, because those plans that we made for influenza-like illness, probably an influenza virus, are transferable to an aerosol-borne virus like SARS-CoV-2. So don't give me this nonsense of, well, it was SARS, therefore we had no plans. I don't buy it.
And just finally, just to go back to where we started, you said that frightening, the phrase is frightening the pants off the public to ensure that they complied with the lockdown, and frightening the public is no way to enact a health policy or a safety policy to get a message across. But actually, isn't that always what governments do? Don't swim out too far, wear a seatbelt, look both ways before crossing a road, install a fire alarm. All of those have adverts that wouldn't look out of place in a horror film.
No, but look, let's take seatbelts, and then I'm going to take MMR with you, because both are really important examples. So I, as a public health person, trained in the art and craft of this, would show to people the consequences of not wearing a seatbelt. And you inform, educate, and you take people with you, like we have with seatbelts now. It's the norm. The same with drink driving. You inform, educate, advise, you change culture, you change perceptions, and in the UK, by and large, people don't drink and drive. And by and large, people wear seatbelts. Now, let's take MMR, because I've done a lot with MMR. So we had people like Dr. Andrew Wakefield, who's still alive and well and causing a nuisance in the United States, talked about MMR harming children. So parents stopped taking the vaccines, and then measles harms the child because it's a serious infection. I was a general practitioner, and I was doing pediatrics as well at the same time. What did I do? I informed, I advised, I educated, I listened to the parents, I heard their concerns, and then I gave them a choice. So some parents were saying to me, you know what, doctor, I don't want this MMR, but I will have a separate M, another M, that's mumps, and a separate R, injection. Can I do that? And I said, it's a free world. You can do it. But please protect your child whichever way you choose. Do you see the difference? Yeah, nudge, not panic. I get it. Very good of you to spare us your time, Doctor. Thanks very much for that. Dr. Bharat Pankhania, Senior Clinical Lecturer in Public Health Medicine at Exeter Medical School. So you've seen these messages, you've heard and seen what went on behind these scenes. What are your takeaways from this week? 0345 6060 973 LBC.
This is LBC.
There are lots of little things you can do to save money on your energy bill, like turning your boiler flow temperature down to 60 degrees, swapping to an energy-saving light bulb, switching off unused appliances, dialing down the temperature on your washing machine, closing all of your curtains at night, and turning a radiator down in a room you're not using. On their own, they may not sound like much, but they all add up and could save you hundreds of pounds. Visit gov.uk/save energy for all